So many people will say maybe she responded for few days and after that maybe she didn't respond. Okay? I'm happy to tell you that about 11 years have passed now after she came here. During these 11 years, I think 12th year now, during these 12 years, not even one injection of insulin she has taken. Not even one. Imagine she has taken 5 injections a day, 365 days. You do the maths.
These questions all the time of why are people so different? A tablet works for me, doesn't work for somebody else. I eat something, I get indigestion. Someone else doesn't get indigestion. I am lactose intolerant, someone is not. I have food sensitivity, I have food allergy, someone else doesn't have. There are so many human biological variations that we see. And all of these variations come from our genes. It is our genes that determine how we absorb food, how we utilize food, how much fat is generated, deposited, how we will behave to exercise, when we will sleep, how we will sleep, etc. All of these are genetically predetermined. In days gone by, there was no way to harness this information and utilize it in any meaningful way. Today, a new era has been born, an era of precision medicine where we can harness the power of our genes and utilize it for counseling, for lifestyle changes, for telling you which is the best food that will work for you. How can you lose weight? How can you control your glucose? What is the best exercise for you? When should you do your exercise? All of these answers you will get if you do the GLC. There are so many variations that get explained through the GLC. So now when we say, what is GLC? Sorry, it's a bit slow. Yeah, what is GLC? GLC is a personalized health approach by you, for you. Your genes decoded for you. You use your genetic informations to tailor specific lifestyle recommendations for you. Diet, exercise, stress management, what are your addictions, what are your intolerances, all of these we can find out. This is science-based wellness. We have so many things out there. There are apps that tell you all kinds of fancy things. There are people telling you all kinds of fancy things. But do they have science behind it? Usually not. Here is an approach where we use science-based wellness in order to help you achieve whatever goal you are looking for. Are you trying to lose weight? Let's achieve that goal. Are you trying to control your glucose levels? Let's achieve that goal. So whatever it is that you want to do, we are using this science of your genes to help you achieve that. We try to bridge the gap between science and actual practical applications so that everyday life choices become routine, become easy, become practical, and they become efficient for you. Your genes don't lie. You are born with them, you die with it. So there's no change in your gene. Your gene is 100%. Once you do this, once in a lifetime, then for life, this is what you are made of. Everybody's genetic code is different. You would have heard that every fingerprint is different. Similarly, every genetic code is different. So using your code, we can say what is the best for you. That is what GLC is all about. So who can benefit from it? Anybody can benefit from it. Depends on what that person is looking for. Is it management of chronic diseases like blood glucose, diabetes, hypertension, obesity, lipids, cholesterol, any of these things are you looking to control? Well, it can work very well for that. Are you someone who's interested in general wellness? Just to know what works for me, what doesn't work for me. Are you someone who's interested in that? This works for you. Prevention. Do you want to know how I can get the healthiest version of me, prevent all these diseases? Yes, it works for you that way as well. Nutrient deficiencies. So it may tell you what these micronutrient deficiencies you may be having or are susceptible to. It may tell you what allergies you may be susceptible to. Healthy aging. Your genetic code tells you all about how soon you will age and many other things. If you are an athlete, it will tell you what your performance capacity is, etc. So it's different strokes for different folks. It's not one size fits all. It depends on you. It is unique for you and only you. So that's what GLC is all about. So just to take you briefly through the snapshot of how it works, the first step will be assessment by the GLC counselors, who I'll introduce in a second. So we ask some questions, I'll tell you about that. Once we have a basic assessment, we then send you the swab. So what we use is a salivary swab for getting your genes. That will be sent to you. It's a kit. Again, I'll show you how that works. Once you send that kit, within a 3-week period, we analyze the genes and a report is generated. Based on that, you will speak to a GLC counselor, that is a genomic lifestyle counselor. You will speak particularly to them, and based on that, you will have, if needed, you can have a follow-up, or depending on what you need after that, it's flexible. So here are the things we look for screening and assessment. We look at your height, weight, your basic anthropometry. We take your metabolic and medical history, gut and energy assessments, physical activity data, family history, social habits, sleep, diet, and food intolerance and sensitivity. So this is it doesn't take too long. It takes about 20 minutes to do, and this can be done on the phone. The other important thing that we'd like to tell you, the entire GLC is a digital one. So you don't have at any point in time to have contact with a physician or come to a center. If you come, that's fine, but you can do everything online. You can register online. Once you pay online, the kit reaches you. Once the kit reaches you, you can send it back. The report and counseling is done online. So it's a 100% online system that can be done from any part of the country. So here's the GLC kit. This is what it looks like. There are a couple of things that are important here. Because we're studying genetic code, we require a consent from you. Please note that without consent of the individual, a genetic testing cannot and will not be done. It's not legal to do genetic testing without consent of the individual. So if this consent form is not received, we are unable to do the test. So we'll show you exactly, there's a QR code, we'll show you exactly how that works. And once you have the kit, your saliva basically, you put it and send it to us in the lab. So here's a small video done by Mahalakshmi, one of our GLC counselors. Opening the cover, that is the consent form, which you will have a registration box and a consent form. Once you open that, those are the swabs that she's holding in her hand. So the first thing is there's a QR code there. She's taking out her phone and scanning the QR code. It opens up like this. Basic information is then collected. Your name, your email address, phone number, nationality, and just some very basic details. That's it, done. Enter the time and date of the sample collection. That it automatically captures this way. Click on the consent form. This is the most important thing. She's also signing the consent form there. You have to tick that box and sign it if you agree for this data to be used for research purposes. Once she's done that, she takes out the swab. As you can see, all of you know about these COVID swabs. Very easy to tell people now. They all know what that is. You know, she's going to take a salivary swab. She just she's putting in her mouth, taking salivas from there. You can see she's doing that. Do it a couple of times so that the saliva absorbs onto the cotton there. And do not eat or drink anything for 30 minutes before you take this sample. Put it there, shake it as she's showing, put it back from where you got it. There are two of that. Put it in the pre-sealed envelope that we have provided in the kit. It's already pre-printed, the address and everything. Just seal it and send it to us. So that's it. That's how you work with the GLC kit, right? And here are our GLC counselors. I now request them all to quickly stand up. And she's led by Dr. Geeta Dharmati, who you saw later. Girls, can you please stand up? And we have a few online as well. So Those who are online, there's a spotlight on them. Our GLC counselors speak all the languages that our branches are based at. So that includes Tamil, Telugu, Hindi. Do we also speak Malayalam, Bengali, Telugu? I said Odia, right? So our GLC counselors speak all of these languages. Thank you very much and good luck to all of you.
Practice of nutritionist. I'm a nutritionist, dietitian. And when I started practicing, it was very easy to blame the genes. My family, my mother is obese, so I am obese. Then the patient came and said, he eats twice a day, he's lost weight. I eat every 2 times. I have lost the weight. Or I follow the same, but I have not the loss. Confusion. Lot of confusion on the social media too. With so much of confusion around, I'm sure each one of you here out there feel, I'm confused what I should eat. Am I right? I'm sure I'm right. That we all feel, I don't know. These people say this is good, that people say that is good. And we as a nutritionist also try to convince the patient with a lot of efforts of counseling what is evidence-based. And then we started doing A, B, C, D as a part of our screening. Anthropometry, biochemical, we see the path reports, we see the clinical parameters, we take a diet recall. We speak to the consultant physician, understand the patient, talk about the medications with the physician and try to give it a diet chart. But then going ahead, these diet charts had their own limitations because any dietitian who gives a diet chart, adherence, compliance is a major challenge. Patient doesn't come back to us. Patient feels it is very boring to follow a diet chart. He follows it for 8 days and then he says that it is too tedious because this is not what I do. You have given me something different. And that's why the dietitians have major challenge with handling patients. Then one more tool we've added now, A, B, C, D. E is exercise, F is food, and now genetics. And now this genetic is trying to tell me, if you can see on the screen, each area of health I'm able to decode. Let me give an example of diabetes or obesity, especially the visceral fat, what Dr. Mohan sir was telling us, that if I have this area of health to handle, like each one of us want to lose weight, and you say, only this abdominal visceral fat, I want to lose weight. We say, we don't look at that, we look at overall obesity, we want to work on your fat, we will give you a diet plan, but now if I know how my body reacts to your carbohydrate, protein and fat. If I have in my plate what I used to eat, roti, sabji, dal, chawal, I belong to Pune, so a little difficult for me to speak in Tamil here, but a typical Indian plate of what we eat ethnically. And I know now with the help of genetics, how the food is connected to me. How does the rice behave with me? How the chapati behave with me? Each molecule of rice, does it get converted to fat or it gets utilized as energy? So this is the science which the genetic testing is trying to help me. It's a connection of diet and genes with me. So we all feel he eats so much, still he doesn't gain weight, and I hardly eat anything, still I gain weight. Is that my genes or is that my environment? So it's a beautiful science which has given us a lot of approach to change the way we give the diet. So we have behavior management, we have nutrients-based nutrition. Many times, I'm sure physicians and doctors agree, malnutrition, type 5 diabetes, sir would agree with me that your hemoglobin, B12, D3, B6, B9, all this typical folate deficiency tells me that you have a chronic malnutrition and that is what is giving you inflammation, oxidative stress, etc. So I give you a nutrient-based nutrition and it helps. Food intolerances. In a city of coffee drinking people, when I say do not drink milk, and you are intolerant to milk, you will say I cannot live without coffee. So if a genetic test tells me you can have 2 cups of coffee, your coffee will behave bad with your liver if you have more than 2 cups. Let me limit the milk to 100 ml. I'm sure you'll benefit out of it. So very positive way of looking at it. There's strict no's are not there. I repeat again, it's more of wellness, it is more of prevention. So nutrition or intolerances or micronutrients or for that matter exercises too. It is not for patients, it is for everyone who want to understand their exercise profile. The competitive exercise world, the BCCI for example, is doing it for all its athletes. because it helps you to understand your injury, your supplementation, your way your body handles the sports, what kind of sports you can do for your children who want to get into competitive sports. If you know beforehand endurance sport, power sports, it works. So why not utilize this tool? And this tool for now at this center, what we're doing is this 10 areas of health which I just spoke about. Your food intolerances, your behavior of the food with you, the macros, the fat, carbohydrate, protein, how it interacts with me. Aging, as Dr. Anjana had rightly said, my skin and hair comes into this, my bone health, my exercise, especially the time of exercise. Am I a morning person or an evening person? So beautiful is your way the body behaves with you. And that is what I think is being showcased in this report. It's a purely wellness, preventive way of looking at your health. Nutrition is the goal, not the diet. Diet is a deprived word, but nutrition is nourishment. And you can see on the screen how the report looks. It's a very patient-friendly or a client-friendly report. Green, orange, red signs. They tell you red signs, lactose intolerance, control the milk. Many a times we feel patient drinks lot of milk, he says your gene is showing red color, I can drink milk. We say it is diet nutrient interaction. You're able to tolerate milk because you're in a very good environment. So avoid it so that in future you may not have any gut health issues. So like Dr. Anjana said, we would like to prevent the illnesses, we would like to take you on a beautiful journey of your wellness is the goal of this report. So one of the area which has been showcased here is your food intolerances, where we are trying to tell you your sweet taste, salt taste sensitivity. We know our genes. We tell us, my mother used to like sweet, I also have a sweet tooth. The bitter taste sensitivity. Actually, we interpret with your nutrients. We try to tell you that, look, you like sweet tooth, you have a sweet tooth. You may eat extra amount of sweet. You are not one gulab jamun person. You can eat 4 or 5 gulab jamun aram se. This is what this gene diet report tells us. And I think it's a good way for a nutritionist or a GLC today, what we call them, to interpret your report better. So the 10 areas which you can see on the screen, I won't go into details. The report is very self-explanatory. But what you can expect is a detailed diet counseling for your patients. It takes you from screening to the supplementation, exercise, behavior, emotional health, everything can be handled. I think the GLC becomes your friend. She holds your hand and takes you on this journey of nutrition and wellness. So in an era of today, Fit India, Fit Bharat, we are looking at nourish your body as per your own genes. And this is what we're looking forward to take you ahead in this GLC journey. Thank you once again to have me take it.
தமிழ்ல தானே இன்னைக்கு முதல் தடவையாக ஒரு புது ப்ரோக்ராம் இங்கே லான்ச் பண்ணியிருக்கிறோம். இதுக்கு பேர் தான் GLC, ஜினோமிக் லைஃப் ஸ்டைல் கவுன்சிலிங். அது என்னன்றது ரொம்ப சுலபமாக சொல்கிறேன். அதாவது இப்போ ஒரு டயட் ப்ரிஸ்கிரைப் பண்ணுறோன்னா, ஆகார கட்டுப்படுத்தல் சொல்லி கொடுக்கும்போது யூஸ்வலாக ஒரு டயட் எல்லாருக்கும் கொடுத்துட்டு இது சாப்பிடுங்க, வெயிட் குறைஞ்சிடும், சுகர் குறைஞ்சிடும்னு சொல்லி கொடுப்போம். பாதி பேருக்கு அது ஒர்க் பண்ணுறதில்ல, சூட் ஆகாது, சிலவங்களுக்கு அலர்ஜி இருக்கும். இப்போ தக்காளி சாப்பிடுங்கன்னு சொல்லுவாங்க, இல்லை தக்காளி சாப்பிட்டா எனக்கு ரீனல் ஸ்டோன், கிட்னி ஸ்டோன் வந்துடுன்னு சொல்லுவாங்க. அந்த மாதிரி பல கண்டிஷன்ஸ் இருக்குது அதில். இப்போது ஒன் சைஸ் ஃபிட்ஸ் ஆல் மாதிரி தான் இப்போ எல்லாருக்கும் ட்ரீட்மெண்ட் கொடுத்துட்டுருக்கோம். எல்லோரும் டயட் எடுத்துங்க, எல்லோரும் நடந்துருங்கோ, அந்த மாதிரி தான் சொல்கிறோம். ஆனால் சிலவங்களுக்கு ஒர்க் பண்ணும், சிலவங்களுக்கு ஒர்க் பண்ணாது. இப்போ புதுசாக என்ன கண்டுபிடிச்சிருக்கோன்னா, உங்கள் அணுக்கள், ஜீன்ஸ், பாடியில் இருக்கிற பிளட்டில் இருக்கிற ஜீன்ஸ், ஜெனட்டிக் மேக்கப் தான் உங்கள் ட்ரீட்மெண்ட்டை வந்து அது பலிக்குதா இல்லையா, ஒர்க் பண்ணுதா இல்லையான்றதை டிசைட் பண்ணுது. ஸோ அதுக்காக தான் இப்போ வந்து இந்த ஜெனட்டிக் டெஸ்டிங் மூலமாக GLC, ஜெனட்டிக் கவுன்சிலிங் வந்து பண்ண போகிறோம். அதாவது ஒரு சின்ன நம்ம எச்சில் இருக்குல்ல, சலைவா, அதை எடுத்துட்டா போதும், அதுலேருந்து உங்களுடைய ஜெனட்டிக் மேக்கப் என்னன்றது தெரியும். அது பிரகாரம் உங்களுக்கு ஆகார கட்டுப்படுத்தல், எக்ஸசைஸு, எத்தனை மணி நேரம் தூங்கணும், எந்த மருந்து கொடுத்தா உங்களுக்கு சுகர் நல்லா கண்ட்ரோல் ஆகும், இந்த பர்டிகுலர் குரூப் ஆஃப் மருந்து வேலை செய்யுமா வேலை செய்யாதா, அதெல்லாம் இப்போ கண்டுபிடிக்கிற மெத்தட் வந்திருக்குது. அது வந்து இந்த ஜெனட்டிக் அனாலிசிஸ்னாலையும் இப்போ AI எல்லாம் கூட வந்திருக்குது. எங்கள் லார்ஜ் டேட்டா பேஸ் வேறு இருக்குது எங்களுக்கு. அதனால் இந்த ப்ரோக்ராம் வந்து நாங்கள் ஆல் ஓவர் த கண்ட்ரி நாங்கள் அதை எஸ்டாப்ளிஷ் பண்ணுறோம். அது இங்கே வரணும், சென்ட்ரலில் வரணும்னு அவசியம் இல்லை, ஆன்லைன் கூட பண்ணிக்கலாம். அதை பற்றி சொல்கிறதுக்கு டாக்டர் அஞ்சனாட்ட ரிக்வெஸ்ட் பண்ணுறேன்.
இந்த ஜிஎல்சின்றது வந்து கம்ப்ளீட்லி டிஜிட்டல் ஆன்லைன் ப்ரோக்ராம். இப்போ என்ன பண்ணணும் அப்படின்னு கேட்டிங்கன்னா, நீங்கள் அதில் ஃபஸ்ட்டு ரெஜிஸ்டர் பண்ணணும். ரெஜிஸ்டர் பண்ணிட்டா ஒரு கிட்டு அனுப்புவாங்க, அது அமேசான் டெலிவரியில் வீட்டுக்கு வரும். அந்த கிட்டில் என்ன இருக்குன்னா, நம்ம வந்து கோவிட்லலாம் அந்த ஸ்வாப் ஒன்று எடுப்பாங்க தெரியுமா, வாயிலேருந்து, அந்த மாதிரி ஒரு ஸ்வாப், அது நாமளே எடுத்து அந்த கிட்டுக்குள்ளே போட்டு திருப்பி அனுப்பணும். அது லேபுக்கு வரும். லேப்லேருந்து 3 வாரம் ஆகும் அந்த ரிப்போர்ட் வர. ரிப்போர்ட் வந்துருச்சுன்னா அதில் க்ளீனாக தெரியும் உங்களுக்கு வந்து எந்த சாப்பாடு வந்து ஒத்துக்கும், உங்களுக்கு வந்து ஏதாவது டெஃபிஷியன்சி இருக்கா, உங்களுக்கு வந்து எந்த டைப் ஆஃப் உடற்பயிற்சி பெஸ்ட்டு, எந்த டைமில் தூங்கினா உங்களுக்கு அது ஹெல்த்துக்கு பெஸ்ட். இந்த மாதிரி நிறைய திங்ஸ் அதுலேருந்து கண்டுபிடிக்கலாம். அதுலேருந்து நீங்கள் உங்கள் ஹெல்த்தை இம்ப்ரூவ் பண்ணிக்கலாம். இப்போ வெயிட் லாஸ் ஆகணும்னா அதுக்காண்டி பண்ணலாம், இல்லை சுகரை கண்ட்ரோல் பண்ணணுமா, பிபியை கண்ட்ரோல் பண்ணணுமா, இது எல்லாமே பாசிபிள் இந்த ஜிஎல்சியோட.
தேங்க்யூ.